The World Health Organization did a study.
Yes.
And it found that 9 out of 10 Kenyans
Yes.
experience the gum disease.
Yeah, gum disease.
Are you surprised by this statistic?
Not really, because actually periodontitis is the most common disease, not just in Kenya, but actually in the whole world. It's a bacterial infection. And because of its nature, the way it starts and presents, that's why people don't really get to take it seriously. And of course, dental awareness has always been low in most parts of the world, especially in the third world countries, because it starts painless. It's an issue of oral hygiene, especially in our part of the world. Now things are changing, but people did not know about the need to brush their teeth, to go to the dentist every 6 months or once every year. And so it starts very slowly as just that plaque, that food that is left around the gums, the bacteria in the mouth attach, they cause a bit of redness, a bit of inflammation on the gums. So you find the gums changing color, starting to bleed. So now that's the early stages of that. It's gingivitis. By the fact that it is not painful, people don't take it seriously. And then because many people get gingivitis when they are young, every time they brush their teeth, they find there is bleeding. So they assume it is normal, then they don't seek any help. But of course, at later stages, gingivitis progresses down into the connective tissues, into the bone, and now affects the supporting structures of the teeth. Then at that point, then we call it periodontitis. In which case, this is more severe. There's a lot of tartar accumulated around the teeth. You find the breath is not very good. You may find a bit of exudate coming from the gums. And eventually you find the teeth are starting to become loose because the bone has been lost. And it was assumed that as you grow older, you will need to lose your teeth. That was the norm. Yes, when you reach a particular age, you lose your teeth. It was kind of like accepted like that because of lack of awareness, basically. But now we are telling people, no, it is not normal for your gums to be bleeding. It is not normal to have an accumulation of tartar around your teeth. It is not normal for your breath to be not good. It's not normal for your teeth to be loose. That's periodontitis, and that's why the prevalence is that high, not just in Africa, even out there in some countries. And of course, the other factor is probably the cost of dental care. The cost is high because of the equipment, machinery, and all that. In many parts of the world, the government is not able to offer that. And also because of the lack of personnel. There has always been a shortage of dental professionals in most parts of the world because of the cost of training a dentist. It's very expensive to train a dentist. So that means you find that most governments are not able to train enough personnel to be able to cater for the whole population. In many places, you find, like in Kenya, the ratio of the dentist to the population is 1 dentist to more than 1,000 people. So then you find many people are not taken care of. And then you find most dentists tend to be concentrated around urban areas. There are large chunks of the country which don't have dentists to take care of them. And then those people end up suffering from gingivitis, from periodontal disease. So that is true. But it's been getting better. The awareness has gone up now. It's there in the media. People know about now brushing their teeth and that kind of thing. So we are not where we were probably 20, 15 years ago.